Do you have postpartum depression, and how would you know? In this video, I'm going to go over the signs and symptoms of postpartum depression, as well as contributing risk factors and why we think reported numbers aren't representative. I'm Allison Lorne, certified nurse midwife, and I have over 20 years of experience helping people deliver their babies and recovering from difficult deliveries. Follow the link in my description to visit my website and learn more about working with me one-on-one. Statistically speaking, postpartum depression affects about 1 in 7 people that have given birth. Now, we think that that number isn't truly representative. Why? Because of the stigma around mental health, unfortunately. There's so much mainstream media messaging that's telling us you're supposed to be in your highlight of your life when you're in the postpartum period. Like you'll be skipping on daisies and falling in love with your baby every moment. But the fact is, postpartum is incredibly difficult and unfortunately pretty isolating. After recovering from a difficult birth, it's a setup for postpartum depression. Now, baby blues is a much milder case of feeling down. You might be weepy, feel exhausted and overwhelmed, and that condition usually comes on a couple days after delivery and lasts for about a couple weeks. Postpartum depression is much more serious. It's characterized by a depressed mood, a disinterest in your life, difficulty bonding with the baby, insomnia, either overeating or undereating, a loss of energy, lack of concentration, and even thoughts of suicide. If you're having any of these symptoms, speak with your healthcare provider. And don't wait till your scheduled follow-up. Reach out to find the help you need now. Furthermore, if you find yourself in crisis, Postpartum Support International is a wonderful resource. I've linked their number in the description, and they have 24-hour service. Furthermore, the National Crisis Hotline for Suicide Prevention can be accessed by dialing 988. You're not alone, you do matter, and if it's about saving your life, don't hesitate to reach out, please. Hopefully you're not finding yourself dealing with a severe case of postpartum depression. Some of the common risk factors include a history of depression, anxiety, or PMS. A difficult childbirth can contribute. One of the biggest indicators is lack of support. Pre-existing medical conditions that might be taxing on your system, whether it's diabetes or cardiac issues, can also make recovery from delivery that much more difficult. Now, first-line treatment recommendations for postpartum depression include psychotherapy and antidepressants, Zoloft being the most commonly prescribed antidepressant. However, understanding that lack of support is one of the greatest risk factors to contributing postpartum depression, I'm afraid we're not doing enough to help people access and find support. If you're interested in meeting others that may have had a difficult childbirth experience or are struggling with postpartum depression, visit my website and fill out an application to join the program. I want you to know you're not alone and that this experience is so common. You might be surprised to discover just how many other people are in your situation. Thanks for watching, and I hope you found this video helpful. Follow along for more uploads on the topic. And remember, you're not alone. Remember, you're not alone. There's help available. I'm Allison Lorne, and this is Holistic Birth Recovery.